At this point, yes, cancer prevention and treatment is what we're going to talk about. And for that, I'm going to call upon on stage a very, very renowned person, Dr. Lenny Costa. Dr. Lenny Costa, very, very welcome to the IAFM conference day 2. Thank you for being here.
Thank you for having me here, Amarjit. You're doing a great job this morning.
Yes, thank you very much. And allow me to introduce you first before we get into your presentation. Cancer prevention and treatment are undergoing a transformative shift with functional medicine strategies. And one area that is of growing interest is the role of melatonin. Okay, so our next speaker, which is Dr. Lenny Costa, who is a renowned consultant geriatrician, preventive cardiologist, and a functional medicine specialist. He has over 20 years of experience treating chronic degenerative disorders, and he has been at the forefront of integrative therapies. So, today he will be sharing his valuable insights on melatonin in cancer. That seems to be a wonderful topic. To start off with the preventive strategies, Dr. Lenny DeCosta, it's all on the stage is all yours. Thank you.
Thank you, Amarjit. Can I share my screen?
Yes.
Just give me a minute. Is it visible?
Yes. Yes, it is. You can put it on slideshow.
Yeah. Done. Okay.
That's perfect.
So first, compliments to the two speakers before me, Dr. Gaurang, an awesome session, and Dr. Verma, even better. So just taking off from what Dr. Verma had to say, yes, if you are looking at putting cancer into remission and not getting it come back, the mind is very important. It's important to be grateful for what you have, and it's important to leave all the bad stuff that you have, like anger, resentment, out. I've seen a lot of patients, I treat a lot of patients, and I know which ones respond and which ones don't. And when they say, I can't forgive, those patients never respond to any treatment. So taking off from where Dr. Verma left, you're so true. Another thing before I start with melatonin and cancer is what Dr. Gaurang had to say. He said, if you get a male, even around 45, 50 or above, who has anemia, please investigate him properly. This has been the hallmark of my career. I probably have picked up more than 100 cases very early of stomach cancer, and they were operated, and none of them had problems later on, and they're still living. Many of them are still living. They're still my patients. So it's so important that you check for if you have anemia, to do a good proper test. So coming back to melatonin, why melatonin and cancer? As we go along, you'll understand why this is such an important molecule, and yet a very cost-effective molecule. If you're looking at using it together with anything that you do with cancer treatments or alternative treatments that you're using, you add on, you see the difference that you get. Second, it's also a great molecule to have if your cancer is already in remission and patient comes to you and says, I don't want it to come back. Can you give me some strategies? And one of the easiest cost-effective strategies is melatonin, and we'll see that as well as we go along. And thirdly, just recently, Dr. Gaurang spoke about onconomics. Onconomics has a variation of that test called onconomics extracts, and it tells you about all the extracts that will work on your cancer. One of the extracts that it also tells you is melatonin. It talks about this particular molecule, whether it will affect your cancer or not. And in most of the tests, reports of onconomic extracts that I have seen, melatonin has worked on most cancers. So it gives you a kind of feel that this is a molecule that we have not looked at, though it has been around for quite some time. It's easily available. There is no any kind of trademark on it, and it's not expensive. So with that, let's go along. We all know what melatonin is, where it comes from, and let me delve on what we don't know, but just let's go through it quickly. Yes, it comes from the pineal gland. It's released normally if you go to sleep by 10:30. It'll be released anywhere between 11 and 2. or 2:30, if you don't sleep during that period of time, the amount of the amount of melatonin released by your pineal gland goes down considerably. So that is something you need to take into account. There are no serious side effects. We'll look at that as well. You don't generally get AM sleepiness, though some patients talk about it. That means morning sleepiness if you're taking it right through the day. Uh, but generally, what melatonin does is when it is dark, it kind of gives you a feeling of sleepiness. But when it is bright light, it keeps you awake. So yes, it doesn't have any issues. There are no side effects. Dr. Pierre Paoli, one of the leading melatonin researchers, has used up to 300 milligrams per day for 2 years, and there were no side effects. So right at the front, before I go any further, let me tell you, melatonin has no side effects, irrespective of the dose that you're using. Uh, the other thing that I want to put right at the beginning is if you have ingested or orally taken melatonin, its levels are sustained only for 3 to 4 hours. So it is wrong to give, or it is wrong to say that, melatonin induces sleep and gives you sleep all night. No, it will give you sleep for 4 hours. And people who do have a lot of insomnia and are using melatonin will complain that they get up after 4 hours and they don't get sleep after that. So keep that in mind. It only is sustained for 4 hours, but you will understand why this is important when you're doing cancer treatment. So this is important to know that it is sustained only for 3 to 4 hours. It rapidly crosses the central nervous system. It crosses the blood-brain barrier. It does not alter any other levels of any other hormones. And most importantly, there is no negative feedback inhibition. So even if you're perfectly healthy, it's good to have melatonin because it works as a good anti-aging molecule for you. Now, one of the things that have come to light is that when you have a disrupted circadian rhythm, it alters the expression of clock genes, deregulates oncogenes, which finally promotes tumor development and progression. So where is this important? It is important for people who work on night shifts. Many of your patients are working on night shifts. Many of them are air hostesses traveling at nights. Many of them work in call centers. So these are the people whose clock genes will be altered. The expression of clock genes will be altered. There will be deregulation of oncogenes. They have a higher chance of developing cancers of all kinds. And that is, then the reason for this is because the circadian secretion of the pineal hormone synchronizes immune system via reciprocal association that exists between immune system and melatonin. This is disrupted. So you need to add melatonin to these people and kind of trick the circadian rhythm into coming into play, especially when they've worked all night and come back in the morning, take the melatonin, make the room absolutely dark and go to sleep. Uh, Melatonin induces big changes and differences between immune cell proportions, enhances their viability, improves immune cell metabolism in tumor microenvironment. So that's another area where melatonin plays a huge role. It directly mediated, these effects are directly mediated by melatonin receptors, or they're also mediated through alterations in hormonal or cytokine release. Melatonin induces apoptosis of tumor cells via both intrinsic and extrinsic pathways of apoptosis, and it protects the immune cells. So melatonin activates anti-neoplastic immune reactivity. It has a direct anti-cancer action. It protects you against chemo and radiation damage. And this is another very, very important, what do you call it, functions of what melatonin does when you give it together with all your other interventions that you do for cancer. On an average, combined results of all of these studies show that melatonin reduced the risk of dying by 44%. And my dear friends, this is published. This is not something that Dr. Lenny Costa is saying. So if you can imagine, this is the kind of effect it has when you add melatonin to your interventions. Why would you ignore it, right? Now, these effects are consistent no matter what dose is being used. So people ask me, how much of a dose do you want to use? And I'll talk about the doses at the end. But it doesn't matter what dose you're using. None of the patients had any significant side effect from using melatonin, and this has been my personal experience. I use melatonin on roughly over 300, have used it over 300 cancer patients for the last 10 years or so. More recently, I've been using it very effectively, even for patients who have put their cancer into remission. They say, please help us to keep it at bay. Many of them have been doing they just finished their chemo and they are on melatonin, and their cancer physicians are talking to them and telling them your PET scans, your repeat PET scans 1 year down the line are showing much better than what we normally expected of you. So this is the effect that melatonin has. There's a substantial reduction in the risk of that, low adverse events reported, and low costs related to this intervention, which suggests today that melatonin has to be used as a good intervention in treating cancer. Now, it has oncostatic properties in a wide variety of tumors. Oncostatic, it just lets the tumor be there. It doesn't allow it to increase. It's a mitochondrial stimulant, my dear friends, and this is one good effect that it will always have on cancer patients. Cancer patients are low on energy. And so when you give melatonin, their mitochondrial actions increase, ATP production goes up, they feel a little more energetic than they would otherwise. It regulates the estrogen receptor expression and transactivation, modulates cell cycle, and induces apoptosis. It inhibits telomerase activity and inhibits metastasis. So if you have a patient who's come to you with cancer, the first thing you do is add melatonin because you don't want his cancer to start metastasizing. Okay, so this is another very, very important action of melatonin. It has a direct anti-neoplastic effect, like we've just said. It decreases rare cell proliferation at very low concentrations. That is a direct cytotoxic effect. That means it kills the cancer cells with high concentrations. Stimulation of cell differentiation, it induces apoptosis, has anti-angiogenesis. So if it does anti-angiogenesis, your metastasis doesn't occur, your cancer doesn't grow. And there's a synergetic effect is found in several cancer types when it is administered together with chemo. So you can administer it with chemo, you can do it with radio. It not only prevents the side effects, but it enhances the effect of your entire treatment. So there are many mechanisms that it works with. One of them is modulation of cell-cell and cell matrix interaction. It causes extracellular matrix remodeling by matrix metalloproteases, cytoskeletal reorganization, and apical mesenchymal transition angiogenesis. I don't want to get into this, don't have the time for it, but please understand it's got very specific multi-pronged attack on cancer when it enters your body. All right. One of the other things that it does is it competes with glucose, because it uses when it's using receptors, it has actions both using receptors and it's independent of receptors. But when it uses receptors, it uses the GLUT family of glucose transporters, and it competes with glucose. Now, glucose is required for cancer cells to grow. By competing with glucose, it doesn't allow the glucose to enter the cell, and when it enters the cell, it causes the cell apoptosis. So it helps in both ways, by competing with glucose and killing the cancer cell directly. All right. Now, in colon cancer, it has a mechanism. I'm seeing the clock run, so I'm just going to run through this. Melatonin is useful in treating colon carcinoma, in which activation of endothelial 1, which is a peptide, has a role in tumor growth and progression. It is directly known to interfere with this particular mechanism in colon cancer. In small cell carcinoma, it also has a role to play. The synergy of melatonin with radio and chemo for non-small cell lung carcinoma has proved useful. This has already been published. In gastrointestinal cancer that both my previous speakers spoke of, the role of melatonin to inhibit gastrointestinal cancer is substantial. The relationship between disruption of melatonin, rhythm, and gastrointestinal cancer is well established. So when you add melatonin, the drug synergy and the role of melatonin receptors cause growth inhibitory effects on gastrointestinal cancer. This again is published as recently as 2015, 10 years ago. It has a huge role to play in breast cancer because of its anti-estrogenic properties. This is useful for breast cancer prevention in cases of obesity, steroid hormone treatment of chronodisruption by exposure to light at night. Now, this is very, very common in ladies who work in call centers, and there's a study done very, very early, much before call centers came up, on women who used to work as air hostesses working on flights. When they had disruption, chrono disruption, because of exposure of light at night, they seemed to develop, they had a higher chance or a much higher rate of breast cancers in them. So melatonin is a huge breast cancer prevention agent. You can use it there. In chemo and radio, it kind of works as a great molecule to reduce the side effects or the oxidative stress associated with both chemotherapy and radiotherapy. It affects every organ. I mean, I've just put this down. I'm not going to go through it due to paucity of time. But yes, it works on all your organs wherever chemo or chemo agents are causing side effects. Melatonin reduces the side effects. Right from the brain down, you can go from top to down, and you'll see every organ where there is damage due to chemotherapy agents. Melatonin reduces that. It is known to reduce the injury on the kidneys due to cisplatin. Cisplatin is a common drug that is being used. Add melatonin to that. It is a direct free radical scavenger and indirect antioxidant. It ensures that it reduces the injury on the kidney due to cisplatin. There's a whole mechanism of action which I put out there. I don't want to go into it. Melatonin is both a direct and an indirect free radical scavenger. Now, this is something that you need to understand when you're using it as a radioprotective agent. The radical scavenging ability of melatonin works via electron donation to detoxify the hydroxyl radical. Now, ionizing radiations result in production of hydroxyl radical. This is what happens when you expose your patient to radiotherapy. The results of many in vitro and in vivo investigations have confirmed that melatonin protects the mammalian cells from toxic effects of ionizing radiation. Now, several clinical reports indicate that melatonin administration, either alone or in combination with traditional radiotherapy, result in favorable efficacy toxicity ratio during the treatment of human cancers. So what does this mean? It means that it actually helps you to allow radiotherapy to work against the cancer, at the same time reduces the toxic effects of radiotherapy, and as a result of which the quality of life of your patient improves. Many a times, many of these cancer treatments, we give the treatments and we lose the patient's quality of life. That is not what the patient has come to you for. So if you really want to improve them, irrespective of what treatment are you doing, many a times the patient's quality of life is a mess. Here is a molecule that will enhance the quality of life, right from giving them energy to ensuring that any treatment that you do, the toxicity goes down drastically, all right? Now, in breast cancer radiation, the dermatitis, it's also known to have a huge role. You can see that the radiation dermatitis went down by about 40% in those who were given melatonin as against just 10% in the placebo group. It has, now this is something that is very important, and this is how it prevents your cancer from coming back when your cancer is in remission. Melatonin has an anti-tumor effect through its effect on cancer stem cells. And what melatonin does is it leads to apoptosis of the cancer stem cells. Now, when your it also has shown that there's a reduction in the drug resistance and invasion of cancer stem cells as and when they are exposed to melatonin. And it's also known that melatonin is an effective agent in treatment of cancer and effective against cancer stem cells. Now, when you give it for as agent against cancer stem cells, what are you achieving? See, the cancer stem cells are those stem cells that will come back and you will have the cancers coming back. That is what happens because your immune system is down when you're exposed to chemo, you're exposed to radio, and a lot of other drugs that you're taking. And you're doing nothing to help that out. But if you add melatonin to any of your interventions, especially the interventions of mainstream oncology treatments that you get, what are you achieving? You are achieving what most of those treatments don't do, and that is a fight against the cancer stem cells. Melatonin, very cheap, easily available over the counter, can be used to prevent cancer stem cells from creating a cancer later on or getting that cancer back. So if you want to keep the patient in remission, remember melatonin hits the cancer stem cells, right? Now, we're coming to dosing. I've got some time, so I'll take a few questions after that. I was trying to finish within the time. This is one of my last slides. One thing that you need to do is when you're using melatonin, the room in the night has to be dark because I want to reduce improve your circadian rhythms. So only red light should be permitted in the bedrooms. One of the things I tell my patients is that there should be no LED or tube lights in the bedrooms after 8 o'clock at night. You have old incandescent bulbs around your room on lampshades so that they can actually use them for reading or keep them on as long as they want, and they should be in bed by 10:30, 11. For prevention, generally, there are people who say 180 milligrams about 30 minutes before bedtime. I don't do that high. That's 60 milligrams 3 to 6 times a day. I don't do that. There are other studies, and something that I use very often is 10 to 20 milligrams 30 minutes before bedtime. I push it up to 20 if the patient can tolerate it. I prefer to give 10 milligrams every 4 hours. Taking you back to one of my first slides, the effect lasts only for 4 hours. So every 4 hours, and if you're giving it with cancer, you need the melatonin effect to be there 24/7. So it has to be given every 4 hours, either 10 or 20 milligrams. So we give it 3 to 6 times a day. So ideally what happens is in practice, even though we give it at 6 o'clock in the morning, 10 o'clock in the morning, 2 o'clock in the afternoon, 6 o'clock in the evening, 10 o'clock in the night, that's 5 doses. The 6th one is in the middle of the night. I don't want to wake the patient up. So the last dose, generally we try and do, if we can get a long-acting melatonin. It's difficult to get, and there we double dose it. So it's difficult to get that, and at times I only land up giving 5 doses. I don't push my patient to get up in the middle of the night to take the 6th one. So you can increase the last dose to double the dose of what you're giving right through the day. So that's the way I do it on a regular basis. This is the dosing I advise: 10 to 20 milligrams, 3 to 6 times a day for cancer prevention. If people who have had cancer, the same dose for people who have cancer and you're fighting it. With everything we have got, you need to add melatonin. It will help you to increase the efficacy of whatever you're doing at least by 30 to 40%. And that's a huge, huge chance you're giving your patient to put the cancer into remission. All right. So in conclusion, my dear friends, melatonin used in various cancer types such as lung, colon, digestive system, breast, prostate, and kidney cancers has improvements in tumor remission rates, overall survival rates, lower specific chemotherapy and radiotherapy side effects in patients taking melatonin, along with their chemotherapy or radiotherapy. I think I've made a case for this. It works beautifully, works well with both mainstream cancer therapies as well as alternative cancer therapies like high-dose vitamin C and ozone, which I've been using very, very regularly. I also started using the far infrared cabins for half an hour every day for my patients. One of the things that far infrared also does is it increases something called subcellular melatonin, which we've never spoken of, and modern medicine didn't know about it till about 5 or 10 years ago. Subcellular melatonin is what helped us get energy when we didn't have food to eat and had to survive in those tough times 70,000 years ago when we used to live in very tough environments. Now our limbic system, our primitive brain does not understand that we are living in such comfort. But we have decided not to take that help of the sun that was so protective to us. One of the things it gave us through its infrared rays was subcellular melatonin. Subcellular melatonin, and the more that you are exposed to the infrared rays, you don't have to be directly in the sun. You could be in the shade, and you get that infrared rays because of the sun's infrared rays bouncing all over and getting onto you. So my day, if I'm at home, is always outdoors on the terrace because and I have my table there, I have everything there. Because of the infrared rays that you get, it increases your subcellular melatonin, increases your energy levels. But melatonin, when it goes up, it ensures that the chances of you getting any type of cancer is low. So you don't only have to take it exogenously, you need to get it also from everything around you. And so those people who get scared to go into the sun, I ensure that they do 30 minutes of far infrared sauna every day, enhances their subcellular melatonin as well. Okay. So with that, I like to close and wind up. I've got a minute and a half. Amarjit, you can ask questions. I will stop sharing.
Really appreciate that you have been on time and such an in-depth analysis of melatonin. Really makes me feel like actually going to the sun right now and getting set with everything. I will just quickly take in a couple of questions. Yes, there are a lot many questions, but I'm just going to quickly take one of the questions which says, what is the optimal dose of melatonin for a healthy person and the dose for a cancer patient, and also mention the ideal duration?
So I just told you I would rather give all my patients 10 milligrams every day, at least once a day, at least once a day. That's in the night. For cancer patients, 10 to 20 milligrams every 4 hours.
Okay, all
It
right,
has worked
perfect.
really well for me. I've tried it out. I see Dr. Vivek there. Thank you so much for saying yes to that. Uh, and Mahesh, thanks for your comments as well. Noted, well noted.
Definitely, if anybody wants to come on stage, definitely I would say you can come on stage. And any particular brand of melatonin would you
So
recommend?
I don't look at brands. I would like to also
Sorry,
say
is there a interference in between? Somebody is trying to get in touch.
no. So Amarjit, I don't use a brand particularly. What I tell people is, uh, when you make a tablet of melatonin, 30% of its efficacy goes down because of the heating that they use to make the tablet. I rather use powders and capsules that are compounded with the powder, or anybody who gives that. Dr. Vivek would probably give you better because he's got a lovely compounding pharmacy that I use off and on. But yes, I would rather go with the powders that you get, the purer form, which will go into a capsule, and so that doesn't kind of mess it up for most patients.
Yes, Dr. Lenny is absolutely right. Rather than tablets, we make them into capsules. One, like any melatonin particularly, it is not very stable. So anything over the shelf, you're not getting the full bioavailability. And the advantage of compounding is we can compound everything into one capsule. If you, for example, need 50 milligrams, some need 100 milligrams, you can put everything into one rather than taking multiple. But of course, you want to divide the doses. So melatonin, particularly sustained release melatonin. Lenny, I don't know if you can throw light on that because I
Yeah, so
prefer
sustained
to.
release melatonin works beautifully at night. Like I said, if you don't have it for the whole night, we have that challenge. So that's why we use sustained release melatonin
Yeah,
in the night. You can do a double dose there. You can specially compound it at that night. And for cancer patients, these compounded amounts are very important because you need that dosing to consistently be there 24/7 for a cancer
yeah.
patient. For a healthy patient preventing cancer or cancer in remission, you don't need that kind of consistent use. It's okay that you
Right.
get exposure to cancer. I
So
mean,
like
cancer.
Lenny, like Tata say we also make steel. So melatonin also, it also induces sleep. So melatonin, everybody focuses on sleep, but it's
Yeah.
more functions as you've explained. It's more important metabolically, immunologically, and it's really underused. I wish I don't know, Mahesh is here. I wish you could have a way to test the efficacy and the actual things of melatonin. We don't have a test. We just have to go with our clinical judgment. Mahesh?
Yes, sir. Nothing right now in serum or in anything else. We do get melatonin metabolites as part of a Dutch kind of panel, and that tells you overall how the melatonin is doing. But we don't get an actual measure, and I do believe, first up, if we can just get into the sun, that's exactly what I was doing. So I kind of had to change our jacket and everything. So
Yeah. What happened?
But your audio
Muted.
has suddenly gone. Can you say again, Mahesh ji?
sorry
That's what
about
the
that.
sun does.
Yeah, I just said, get in the sun and, let your body make as much melatonin as it can. And that's going to
Absolutely.
be,
Just a minute, Mahesh, just a minute. Get in the sun will actually get rid of your melatonin, but it's important for the circadian rhythm. I get your point.
yeah.
It's important
Yeah,
for
so
circadian
what I
rhythm.
meant
Getting in the
was
sun.
that, so, if we just manage our light biology, right? So get in
Yes,
the sun as in early morning sun, get in the sun
correct.
as in sunset, and use blue light blocking glasses at night, you're going to get your melatonin back in the circadian rhythm.
Yeah, this is very
Mahesh,
important because, yeah.
don't take this very seriously. Dr. Vivek was just sharing with you that he is listening to you very, very intently.
Preeti, I want you to laugh heartily. I'll record it and you can take a royalty. And I think it's a great medicine. If people just listen to Preeti laughing, it's not laughter is best medicine. Preeti's laughter is best medicine. I think she has the best
Infectious
laugh.
in the nicest way.
Thank you.
Thank
Very
you, thank
clearly.
you,
Yeah.
thank you
Thank you,
so
Dr.
much.
So happy
Lenny.
that I was able to.
Lenny, the
I'm so
light
happy that I
management
was
is
able
key.
to at least.
Yeah.
I was so happy that I was at least able to induce a discussion on this molecule. It's an excellent molecule. My take-home message, guys, you get subcellular melatonin from infrared exposure, far infrared or near infrared exposure. But for your cancer patients, please supplement them. Don't just take it off the shelf. It is cheap. Uh, for cancer patients, you need targeted therapy. You need to use good compounded medication if you can. And it's excellent to use it every 4 hours. That's the take home message. For people who don't want to get cancer, take 10 milligrams. It's just not a sleep medication. It's going to give you a lot more benefits. I can guarantee you that much. I use it every day, 10 to 20 milligrams. And there are friends of mine who use up to 60 milligrams. Nothing's wrong with them. They're in fact
And there's
much
no
more
point
healthier than.
no point in taking melatonin and exposing yourself to the blue light or your laptop or your phone is going to wipe
Yes,
out that
exactly.
melatonin. So it's management the light that is important. Amarjit's waiting to come in. He says, "Arey, bas karo, abhi
No,
kal."
as it is, Amarjeet ने मेरा session 10 minutes बस कर दिया है. अब now she's saying और कितना कम करवाऊंगी?
All
All right.
right, all right. Thank you for all that
Thank you
laughter
for having me
induction.
here. Thank you, Dr.
Yes,
Preeti.
yes. Thank
It
you
was
so much.
awesome to come here
And it
again and give you an exposure on what I do with melatonin. So thank you
Okay.
for having me.
Lenny, now we look like brothers.
And I'll tell you what, it is such a privilege to have, some of our wonderful speakers on the stage all together. That is why I kept all of you all together. And that laugh definitely much required. I can see the audience also sending in a lot of love there. Thank you once again, Dr. Lenny Costa, for that wonderful thing and a little panel discussion here. But no problem. And now, so thank you once again. I'll just be moving the spotlights. Thank you very much, Dr. Kadambi, for being such a sport. And thank you, Dr. Mahesh Jayaraman, as well.